My name is Dr. Dilawar Padhani. I am the Managing Director of Diamond Opticals Limited. Today we are going to discuss about dry eye syndrome or dry eye disease. Our eyes need tears to stay healthy and comfortable, and our tear glands produce enough tears to keep our eyes lubricated and moist. There are three sets of glands which are located in the eyelids and one set of gland which is outside the eyeball in each eye. So most of the time it is known as dry eye syndrome. Some people call it dry eye disease. So they are same conditions. If our eyes do not produce enough tears, it is called dry eye syndrome. It happens because of lack of tears or evaporation of tears or dryness of tears, or the quality of our tears is not good. Also we will get the problem of dry eye syndrome. So how many people are suffering from dry eye disease or syndrome? So worldwide there are 344 million people who are suffering from dry eye disease. So there is a wide variation in the prevalence worldwide. It is from 6.5% to 52.4%, and prevalence increases with age. So how does it work? If your eyes are irritated or very dry, there will be a lot of tears coming out of your eyes. We call it a reflex tearing. At this stage, our main lacrimal gland contributes in tear contribution. So what are the main causes of dry eye syndrome? So number one is autoimmune disorders, in which we classify rheumatoid arthritis, Sjogren's syndrome, pollution, hot and humid environment, long use of computer, people using contact lenses, they are also suffering from dry eye syndrome. Eye surgeries, whether you have cataract surgery or other surgeries, you will have a lot of dry eyes. And there are certain medicines which also give dry eye syndrome. Now, who is suffering from dry eye syndrome? Usually older people more than 65 years old, they are suffering, women and smokers. So when you have dry eye syndrome, what do you feel? So you will have dryness, grittiness, photophobia, poor vision, tired eyes, you will feel sleepy all the time, stringy discharge, and eyelid inflammation. You will have eyelid inflammation and swelling again and again, but you will not be able to find out the cause. So just rule out dry eye syndrome in that case. What is the treatment for dry eye syndrome? There is no permanent solution for dry eye syndrome, but there are some management advices which are given to manage dry eye syndrome. So number one is you have to modify your lifestyle. So what do you do in modification? So stay away from warm and humid environment, protect your eyes while driving, and if there is a lot of wind, and limit use of screen time, whether it is laptop or phone or whatever it is. So most of the time, if when you go to a doctor, they will advise you artificial tears to alleviate your symptoms of dry eye syndrome, and they also advise you to use ointment at night to keep your eyes moist. Sometimes they may also recommend you antibiotic or steroid ointment for inflammation. There are other surgical options which are, if your medicine does not work, then we give you surgical options, in which we have punctal occlusion and tarsorrhaphy. Thank you very much for your attention.